Hi, my name is Holly Paldrell, and the disorder I chose for our Disorders final video is the post-traumatic stress disorder. I chose this disorder for this assignment because it's a psychological disorder. In this presentation, I'm going to cover the symptoms, diagnosis, and detection of this disorder. I chose this disorder because it affects many people I know and is very well known, especially in the U.S. military, in regard to veterans. Post-traumatic stress disorder is a mental disorder caused by a traumatic event that a patient has previously experienced. PTSD is very prevalent in the U.S. 7 out of 8 adults have post-traumatic stress disorder, and many of those adults have served in our armed forces. With a total of about 8 million adults having this disorder during any given year. The psychological and physical symptoms that are associated with this disorder, especially and behaviors, are flashbacks, emotional numbness, insomnia and sleep disturbances, anxiety, sadness and or depression, dissociative experiences. Some of the physical symptoms can be shown up as migraines, back pain, stomach aches, hyperarousal, and things like that. Diagnosis and detection, you would probably go and make an appointment with the doctor because you're having some issues. And a doctor will perform a physical exam to check for any medical problems that may be causing your symptoms. They do physical and psychological evaluation, which includes discussion of your signs and symptoms and any events that could be causing you to have the issues that you're having. As far as the role of nature and nurture, whether it can be caused by biology or your environment, PTSD is heritable, but in most cases, it is something that comes from what you've seen, or an environment or trauma that you've had in your past from being in a certain situation. Any specific approach, any approaches that they do have for it, there are many for PTSD, but the most effective is cognitive behavior therapy. And what it does is it focuses on the trauma that you have had and anything that could have caused it and the events that have caused it, and having therapy for those. And that has been shown to be the most effective way to treat PTSD, even though there are quite a few therapies to do so. This course has helped me in a lot of ways. It's helped me greatly in understanding how anyone's mind can be affected, whether it be to a battery of things caused by the environment or just by their upbringing, nurture versus nature. Lots of people have lots of different reasons why they have different mental illnesses, which is a really big thing that this course has taught me. The information that I've learned in this course, I would have to say, would help me a lot in the future, and I will take it with me. I never know if it could help me with a person that I know, knowing the signs from things that I've learned in this course, or just someone that happens to come into my office anywhere that I would work in the future. So that is my video. I did it on post-traumatic stress disorder. I hope that you found it knowledgeable and full of information, and thank you for your time.